Hi, everybody. Welcome to Autism BC Talk. Today, we're glad to have one of our board directors, Sara White, who is also a BCBA, to be with us to talk about behavior consultant. Hi, Sara. Thank you
Hello.
for coming and helping us. And can you briefly talk about your background and what your professionals are?
Sure. I actually started out in the field as a BI way back in the day, a very long time ago. And I then got my master's degree in clinical psychology with a specialization in applied behavior analysis, and then went on and got my PhD in clinical psychology. And so I actually have a BCBA D, meaning I have a PhD level qualification for a BCBA. So I have been working back in BC for about 20 years now, mostly remotely since COVID. And I also have a practice in Bellingham. So I kind of work cross-border currently, and I mostly do, like I said, remote consultation. I'm usually consulting with teams that already have a full-time behavior consultant or behavior analyst on board, and I'm just sort of coming in to help either when there's a mental health question in regards to some of the programming, or if there's a super tricky behavior that they're having trouble working through. So I'm sort of just peripherally involved in BC and sort of direct clinical service. And then I also do serve on the board of Autism BC.
See, thank you very much. And is there a special age range that you work with, or from birth to adult?
Yeah, I pretty much run the gamut right now. My youngest client that I work with, or that I have staff that work with, is I think 3, and the oldest is 35. So it really does run like the
Wow,
whole gamut.
I see.
Mhm.
Wow, we like it's really hard to find consultants who work with adults.
Yeah, yeah.
So, okay, let's start our question today because we have a lot of questions around behavior consultant and behavior analyst. So, what exactly makes somebody a behavior consultant, and are they the same as behavior analyst?
They're not exactly the same as what I would say would be the short answer to that question. So a behavior analyst is a really specific term. It's actually trademarked by the Behavior Analyst Certification Board, which is a national credentialing body within the US, and they do credential in Canada. I can't remember, there's 1 or 2 other countries. So it's sort of national/international. They used to be more international, and they've dropped a lot of their non-English speaking certifications, unfortunately. But they're a certification board that's based in the United States, and it is a protected title. So in order to call yourself a behavior analyst, you have to be certified by the board at either the bachelor's level, the master's level, or the PhD level. So there's 3 different levels of certification, and different amounts of coursework requirements and different amounts of experience requirements that go along with each of those levels. A behavior consultant is a more general term. I know it's the term that's used by the RASP in BC, because not everybody on the RASP initially, I haven't checked lately, but not everybody initially on the RASP was a behavior analyst. Some of them were master's level people who'd been practicing in the field for a specific amount of time. And also, to get on the RASP, they do require additional hours specific to kids with autism and specific to kids under the age of 6. So they have sort of another layer of qualification that does make it slightly different than a behavior analyst. So I would say not everybody who's a behavior consultant for the RASP is also a behavior analyst, if that makes sense, right?
Okay.
Because they don't also necessarily always have that certification. I know they were trying to move towards the majority of new people having that certification. But I haven't, like I said, I just haven't gone through it recently to see who's on there that's not an analyst as well as a consultant. And then behavior consultant is also sometimes used like in school districts or in other agencies, again, for people who don't have that credential of a BCBA or a BCABA, depending on what level they're credentialed at. So it allows somebody who has worked in the field for a long time and has a lot of experience and has a master's degree or a bachelor's degree to perform some of the same jobs. It's just not as strict of a criteria, I guess is what I would say. The other thing that a behavior analyst has to do is write a test to prove proficiency. So there's a licensure test or a certification test that they have to pass, with a certain amount of proficiency. So they're not exactly the same, but they're very similar in terms of what they mean.
Okay. So with an analyst, they actually have a licensing body. So you really have to go through all the tests and certification.
Correct.
Okay.
They have a
Gotcha.
certification body, which is different than a licensing body. We've been trying to get behavior analyst license in BC for a while, but it's with all of the other stuff that's going on with the licensure boards, it's been a little bit tricky recently. But so there's technically not a licensure in BC for behavior analysts, but there's a national credential.
Okay. Got it. Thank you. So we heard that there are families who are trying to hire behavior interventionists directly.
Mhm.
So do they really have to work under a behavior consultant or an analyst, or people can just hire behavior interventionists directly to work with their loved one?
In BC, again, the rules are different, right? So technically right now, if kids are under 6, there does need to be a behavior consultant on the team in order for the family to access that funding for behavior interventionists. Over 6, as we all know, things get a little bit less strict, right? So you can kind of do whatever you want with your funding. But if your BI is being ethical, they should be practicing under a behavior consultant because they don't have the expertise and training to do the higher level programming. Their BIs are the equivalent. If we're thinking about the school system, right? BIs are the equivalent of a teacher's assistant, right? So an SEA or whatever it's called within your specific school district, because the name varies from place to place, right? So the BI is equivalent of an SEA, and the behavior consultant is the equivalent of a teacher, right? So if you have just the SEA or the BI directing the program, there could be things if you have a kid who's a tricky learner, if you have a kid who's outside of the experience that this BI has dealt with before, that might not have the experience and training to appropriately address whatever the needs of the kids is in that really specific situation. So they should be working underneath the behavior consultants. I know that creates a funding situation, particularly for kids over 6, but hopefully you can find a consultant that'd be willing to work with you, even just providing a little bit of oversight so that the BI has some oversight and some assistance if things don't go according to the plan that they have.
Okay, but the plan initially should come from a
Correct.
behavior
Behavior
consultant, right?
consultants.
So
Exactly.
like the BI just execute it.
Yes,
Okay.
exactly.
All right.
Exactly.
So they have like very different role.
Yes.
Okay.
Yeah.
Cool. All right. Thank you. So are there different types of behavior consultant, like as I mentioned, a specific age group that you guys specialize in, different diagnosis, high-low support needs, or like you mentioned, like with mental health, co-occurring conditions? Are there different categories of behavior consultant when we're looking for their service?
Technically, there are not right now. There aren't either with the BCBA or the BACB, or, and I'll say what that acronym means in a minute, or with the on the RASP list. But again, having a provider who is on the RASP list does give you some information that they are specialized in younger kids, which not every behavior analyst or behavior consultant would be.
Right.
So the RASP list is sort of a subcategory of that because they do require specific training and experience in working with young kids versus older kids. But again, once you get over 6, there's really not subcategories. Like there's not the equivalent of like a pediatrician or a psychiatrist in the medical field, in the ABA field. It really comes down to parents asking behavior consultants and behavior analysts questions about what areas do they specialize in, what experience do they have in the specific age range to their child, or high support needs, low support needs, that kind of thing. There definitely are people who do specialize in those areas, but there's not like a different certification that would tell a parent up front that they specialize in that versus not. So those are the types of questions that parents should be asking their behavior consultants or behavior analysts before they start working with them, is how much experience do you have working with kids who have X, Y, and Z, right? Depending on their specific kids' needs and presentation. I would say in general, the mental health piece of things, that not very many behavior consultants have experience with the mental health side of things. Unless again, there are a few out there who are registered counselors and behavior analysts. There's a couple, I want to say 4 or 5 now, maybe more, 4 or 5 that I know of off the top of my head. So there are some people who sort of have a foot in both worlds, but they have specific training in both of those spaces, not just I'm a behavior consultant who's worked with a bunch of kids who also have anxiety. Like I did training to be a behavior analyst, and now I did separate training to be a registered clinical counselor, or in my case, a psychologist, right? So it really is that you would have like a separate certification that would tell you that this person also has the ability to work with things on the mental health side of things.
I see. So if you look at the reps list or you call up the college, like the BCBA, they won't be able to tell you this person is
Correct.
specialized in. Okay,
Correct.
okay,
I think the
got it.
RAS list used to, and I have not dug around on it recently, used to have sort of like a brief description of what people self-identified as their area, but there's not like additional checking on that, is what I would say, right? Verification. There's not independent verification of that. It's just taking the person's, which you hope they're telling the truth, but taking their
You
word
can
for
check reference, I guess.
right, exactly. Taking their word and you exactly, you can check references. That's what I've definitely had parents do that with me before, where they asked for a couple of parents that I've worked with as a reference, which is a
Yeah.
great strategy.
Mhm. So, like when you're working with a behavior consultant or behavior analyst, what can you expect from them? Like they are not like BI who work one-on-one with your child usually, but what do you expect when somebody come in and work with you as a parent, as a family? What, like
Mhm.
essentially, what do they provide?
Yeah. So typically they would come in and they would do, well, number one, they would come in and they would generally interview the parent and talk about like, what are your goals? What are the things that you want for your child? What are the things that are important for you and your family to work on that would make the biggest difference in sort of your daily lives, right? So maybe it's day activities of daily living and being able to perform those, being able to brush teeth and brush hair without there being a giant tantrum, those types of things. Or maybe it's toilet training, or maybe it's, this really challenging behavior that you're dealing with, like aggression or that kind of thing. So they'd come in and they typically meet with the parents first to sort of get an overview of like, who is the kid? What have they tried before? What are the specific behaviors they want to work on? And then they would design, both a behavioral intervention plan, which would sort of talk about like, here's how we're going to address the specific behaviors that you want to address. And oftentimes skill acquisition plans that would go along with that would complement that, right? So which behaviors do we want to see decrease? And then in their place, which behaviors do we want to see increase, right? So if I'm trying to decrease behavior that I think is a form of communication, I want to make sure that I'm building up the child's communication skills to be able to tell me whatever it is they're trying to tell me that they're currently telling me with behavior, right? So there should be complementary, there should be both sides of that equation, right? If we're reducing behavior, we should also be increasing behavior to replace that. Um, and and or maybe it's just a skill acquisition plan, depending on this particular presentation of the child. Maybe there's not a bunch of challenging behaviors. Maybe it's just, I need my kid to be toilet trained and I don't know how to do that on my own. So they would come in and sort of design the overarching plan, and then they can either train the parent to do it themselves directly, or they can train BIs to do it. Or sometimes some people prefer to work the first parts of the program themselves as the behavior consultant if the family has enough funding, because then they can really get to know the child and the family really well. You know what I mean? Make sure that the behavior plan and the skill acquisition plans are exactly how they think are going to work best for this particular child, and then hand it off to either a team of BIs or to a parent, depending on the specific family circumstance.
Okay, so can we expect like more than only training a BI? Like, do you guys do like parent training? Because BI
Yes.
is not like 24/7, right? If this
Yes.
behavior only occurs during nighttime, so you will
Correct.
also do parent training.
Yeah, for sure. And I think it's a really good point too, specifically, especially if it's something to do with like sleep stuff, then often it is the parents who have to sort of do the heavy lifting, because It's tricky to find a BI who wants to come and spend, 7 to 10 p.m. at night with you, right?
Right. And if
So
they only do it with the BI, it doesn't really help, right? If the BI is gone.
exactly.
Okay.
So some people, and again, it depends on sort of the family dynamic and how busy the parents are and how much time they have and when this behavior is, how much energy they have, because sometimes they're also very tired from having managed, I mean, depending on the age of the kid and how much they're sleeping, et cetera, right? So sometimes they don't have the energy to do some of the initial teaching. So sometimes it's easier to have the BI do some of the initial instruction if possible, and then hand it off to the parent. But sometimes the parent is the only person that can do a lot of that heavy lifting. Specifically, if it's related to like early morning things, like activities of daily living that can only happen in the morning, or, some toileting stuff can definitely be worked on in session, but like I've worked with kids that only, have a bowel movement at a certain time of the night, right? So then it's hard if it's only something that's happening during a really specific time period, and that's not when BIs are typically at the house. That really is going to fall to the parent. So ideally, the behavior consultant is training both the BIs and the parent so that there's a consistency of how behaviors are being addressed and how skills are being taught across people, right? So if I'm teaching a kid in session, let's say how to wash their hands, and I don't teach mom and dad how to do that same skill, then potentially mom is prompting him differently than the BIs are prompting him, which could lead to confusion, right? So do I get the soap and then wet my hands, or do I wet my hands and then get the soap? And it sounds like teeny tiny little differences, but for kids on the spectrum who, number one, like things to be done in a certain way, typically speaking, and who may take longer to learn that behavior chain, even small differences can lead to really big like differences in lengths of time to acquire skills, right? If he's being taught to do it 3 different ways, often the kids that I work with, that's not just like, oh, all of these things are 3 different ways to do the same thing. It's like 3 different individual things because they don't generalize well, right? So if we're teaching toothbrushing or hand washing or even dressing or, getting ready for school and putting on your shoes, the more those things are being done in exactly the same way, the faster kids are going to acquire those skills. So I do think it's important that we are consistent across parents and in session and ideally at school as well, right? Ideally, all of those environments are working together to have one cohesive plan for that individual, how they're going to learn the skill or how we're going to address a behavior when it happens in a moment, so that there's not an inconsistency across environments or people for the kid.
Yeah, so that comes to my next question. You not only work with BI, the family, but you also work with school.
Ideally, we're working with schools, different, I would say, a little bit less in touch with sort of different districts within BC, but different schools have varying levels of openness, is what I would say, to working with outside consultants, right? And some districts are great and are super open as long as you follow their process. They typically have like a certain way that they want you to like request to do an observation and forms that need to be signed and all that kind of stuff. But some schools and systems are really open, and then others are not as open. And so it really is unfortunately up to the parent to advocate to get the behavior, like at least have a meeting, right? Have the behavior consultant come to the IEP meeting so that you can have a conversation about how you're going to address this, or are you going to divide up skills and school's going to work on this and home's going to work on this, right? Like just so that there's sort of a plan in place of who's doing what minimally.
Yeah.
In my ideal world, it all is one nice system that works together seamlessly, but I know that's not always the reality of what parents are facing with school versus home, right? But the more, at least if they can be at a meeting, then if there's not going to be an opportunity to work collaboratively, then there can sort of be a division of labor in essence, right? So that you're not both working on the same thing in different ways, because that's not an efficient use of that particular student's time, right? To be working on the same thing in 2 different ways, just be working on 2 different things that are both things that he needs to work on learning.
Totally. And the consistency too, as you mentioned,
Exactly.
right? So
Exactly.
having said that, so will you work like behavior consultant, work with other professionals, like if the family is working with SLP, OT, and PTs, do you guys do it as a team usually, or separately, as you
Ideally,
said, different goals?
right. Ideally, you're working together, right? Particularly if we're talking about, I mean, I think SLP and OT would be the two most common professions. I have fewer kids that have PT just because I have fewer that have like those really specific physical, either muscle weakness or whatever that really get them into the PT realm. Often it's just OT and speech. And I think, again, the more collaboratively you can work together, the better, right? There are techniques from OT that can help with emotion regulation and behavior regulation during sessions. And then there's behavioral techniques and, working the behavior plan that can help work through behaviors that are happening during OT session or speech session, right? So to me, they sort of go hand in hand. And the ideally, again, also, like if we're teaching, I don't know, let's say a fine motor skill, like if we're working on handwriting in session, which I don't do super frequently anymore, just because I do try to let, that's a school realm or an OT realm, but if they need additional practice, say, and we're working on handwriting, I want to make sure that however the OT is teaching it is how we're practicing it in session, or again, we're working against each other, not with each other, right? And so if I'm teaching letter formation in one way and the OT is teaching letter formation in a different way, then it's going to take the kid twice as long to learn that skill. When really, if we both worked on it in the same way, it would take half the time because we're both approaching it in the same way. Same thing with speech. If I have an SLP who, let's say I'm working on an augmentative communication device and they have it set up one way and I have it set up another way, then it's going to take the student much, much longer to learn how to use that device effectively, right, to communicate. So the more all of those things can be integrated, the better. And again, like this comes from both sides of the fence. Not everybody works well together, is what I will say, right? Both on the behavior consultant, behavior analyst side, as well as on the speech and OT side of things. But hopefully, as a parent, when you're putting together your team, that's one of the questions you're asking professionals is, are you willing to work with? We have this person already on board doing speech. Are you, as a behavior consultant, willing to work with that person and work collaboratively for programming? And if the person's like, oh, whatever, I don't like working with that person, or I like to do my own thing, then that should be a red flag for you as a parent, because really all of those services should be collaborative and integrated. And that's just going to be the most effective and efficient way to deliver services.
Right. So it's not essentially if you hire a BI and a behavior consultant, the behavior consultant will integrate all those PT,
Yeah,
SLP, OT stuff into the daily programming, and the
exactly.
BI have to execute it like
Yeah.
integration.
Yeah. And then it just gives you more trials and more practice, right? So then ideally you're not just getting speech for whatever, half an hour twice a week or an hour
Right.
once a week or whatever. You're having it, a little bit every day when you have the BI there doing work. Again, overseen by the behavior consultant who's then collaborating with the PT, OT to funnel the information down to the BIs.
Oh, that makes sense. Totally. Yeah. That means
I've worked
increasing
with
the OT hours.
OTs and SLPs that'll come to like team meetings, right? Who
Right.
we can have like a team meeting with the BIs, the parents, the behavior consultant, and speech and or OT, who all come and talk about like all of the programming that we're doing. And then the speech be like, well, what if you did it this way? And the behavior consultant like, oh, that's a great idea. I'll change the program. And then the BIs know what to do, right? But everybody sitting at the same table, not literally these days, sitting on the Zoom meeting, which
Virtually.
is what happens. um, Having those conversations, right?
Yeah.
Again, so that we can all be collaborating together. It's a little bit expensive, right? Because you're paying for two professionals' times to be there. But if you have the funding available, it just is the most effective way. It's going to be the best use of your child's time to
Right.
be having all of those people working together to design the program rather than everybody sort of in their own silo doing their own thing.
Right. Totally makes sense. So, okay, if we have a team formed like that, or only with a behavior consultant and a BI, how can we determine if this behavior consultant, as you said, is the best match for my child or like meet the expectation? How long shall we wait and see the results of development coming?
Mm-hmm, mm-hmm. So I think there's two sides to that question in essence, right? One is like, is it a good fit for my family? And the second is their programming effective? So I'm going to answer the first part first. Is this a right fit for my family? And I think, is it the right fit for my family comes from you as a parent, like interviewing your behavior. I know it's really hard right now. I mean, everywhere, not just in BC. It's hard everywhere. There's not enough behavior analysts / behavior consultants to go around. And so you feel a little bit desperate. You send out, literally, I think I get probably emails that have been sent out to like 100 people. And like one person responds back. And I think you feel as a parent, like, oh, I know I got to get on this early and I got to do this right away. So I'm just going to take whoever I get. But sometimes if it's not a good fit, it might be worth not taking the first person who responds back and waiting and finding somebody who's a good fit for your family, who fits with like your philosophical approach, who fits with, what you want in terms of services and service delivery. So I think you should be interviewing people, and you should have, just like you would when you're hiring a BI, right? That you should have a set of questions that you're asking all of the different behavior consultants / behavior analysts that you're interviewing. And if you don't think it's a good fit, it's worth waiting, right? For whatever reason. You don't think the personality will jive with, like, it's not just about like the skills and specifics. Sometimes it's about the non-specifics, right? How do they communicate with you? Do they communicate in a way that you understand, or are they talking in a bunch of jargon that you can't understand, right? Are they coming in with the approach that they're right, always right, and they have the answers and they know what's best for your kid? Or are they saying to you, I have all this expertise in how to teach kids, but you're the one who knows your kid best, and help me work collaboratively to design these programs, right? So, and, are they willing to work with speech and OT? Like all of those questions, depending on you and your particular circumstance and what you think is important. Is this a family that's separated and two parents are living in separate households? Are they willing to work with two different households? If they're separated and it's not amicable and really just working with one, are they willing to just work with one? Or are they going to get in there and be like, well, I really need to be in the other house too, right? So all of those specific things are things that you should be thinking about as a parent. What do you really want, and what's really important to you? Are they, neurodiversity affirming, or are they coming in from a more sort of traditional ABA, which is where we all get our bad name from, but like, are they coming in from a more traditional approach and like have a specific way that they think is best, and they're going to follow this curriculum no matter what? Or are they going to be like, oh, this is your family, this is your value system, I'm going to match the programming to your value system. And so I think you can get at all of that with a really good set of interview questions, right? And I don't know if you guys at Autism BC have a resource that's already posted. I'd be happy to help you develop one.
Oh, that'd be great. Yeah,
Sort of
because
come up
like
with a set of
times have
questions that are sort of
changed.
like, yeah,
Yeah, if
exactly,
we interview
exactly.
the traditional way, it's very different from
Yeah,
what the family needs right now.
exactly. So I think what we could do is maybe we can curate a list of like potential questions, and obviously you don't need to ask 20
All of
questions.
them.
I think you can pick out the 5 that are most important to you. And those are the ones that you ask everybody, either via email or in person. I've definitely answered like an email questionnaire before from potential clients as well, which can be a good way to just, do people even take the time to fill out, to reply back to your 5-question email or not?
That
Right.
makes sense. Yeah.
So, I mean, I think as a behavior consultant, like being on the flip side of that is I don't want people to choose me because I'm their only choice. I want to choose them to choose me because they think I'm a good fit for them and their family. Because I've definitely gone into situations where I'm very diversity affirming, and the parent is like, no, I don't want him doing these particular things. And I'm like, well, I don't feel comfortable doing that either. Do you know what I mean? Because I think a little bit of stimming is okay, and that's fine. You know what I mean? And so sometimes there's not good matches for a number of reasons. And sometimes what a parent wants and what a behavior consultant can deliver are two different things. And so I just think that parents and kids deserve to find the person that's the right fit for them, and not just take whoever's available, which I know is hard because, again, you get your diagnosis, people are like, get on this list, find a behavior consultant, do it quickly, because what we do know is the earlier the better, and the more the better for intervention. So I understand that push, but the wrong intervention or the wrong fit for your family is not going to be helpful in the long run
Or
either.
it can be harmful.
Right, exactly. So sometimes it's worth waiting to find the person that you think is actually a good fit for you versus just taking the first person that's available.
Great. So like now you found somebody you think is a good match.
Yes.
And you don't see progress.
Right.
So like, how long shall we wait to?
Yes. No, that's a really great question. And I mean, I think I haven't said this yet in this interview, which is interesting because it's normally like my stock answer to a lot of questions, which is it depends. But I would say, it does depend. However, often things do take a little while to, and progress can be slow in the beginning. So I would say that there's a number of factors involved here. So number one, how many hours a week of intervention does the child have? What are their support needs, right? What is their cognitive level? All of those things are going to factor into how quickly or slowly things are going to move. How long has the behavior been going on for? The longer, like the older the child is, the longer the behavior's persisted for, the longer it's going to take to see positive change on the other side, right? If this is a kid who's 15, been doing this behavior for 10 years, not saying it's going to take 10 years to see change, but it's going to take longer than if the kid is 4 and has been doing the behavior for 6 months, right? Like there's going to be a certain amount of pattern and habituation of that behavior. If a kid is older or been engaging it for longer, that's going to take time to change. However, I would also say if you are seeing behavior increase significantly, like I know sometimes things have to get worse before they get better. Ideally, we're trying to mitigate that and have that not happen or minimally happen. But if you're, all of a sudden you're seeing all these new, more extreme behaviors than you've seen in the past. So a kid who wasn't aggressive, who now is, a kid who, wasn't self-injurious, who now is, that's a red flag to me that something's not right, right? We shouldn't be seeing those types of more extreme behaviors increase because of an intervention that's in place. If that's happening, there's some kind of distress happening that's at too high of a level, and we should be looking to modify programming. If it's slow skill acquisition, again, I would say, are there incremental steps that are happening towards whatever your end goal is, right? So toileting is going to take a really long time. Like that's just the way it goes. Start to finish, it can take 2 to 3 years to go all the way from being, fully in diapers to being fully independently toilet trained without accidents at night. So, but are there baby steps that are happening towards that end incremental goal where you can see them that are tangible, right? So, he's willing to go into the bathroom more than he was before versus like, is he actually voiding on the toilet? Because again, if you have a kid who's got a lot of anxiety around the toilet, maybe just being in the bathroom is like the first step, not actually sitting on the toilet voiding, right? So are there incremental positive steps that are happening? And then if they're not, are there program changes that are taking place in response to that because what's happening isn't working, right? Or isn't producing the change that we want to see, either by, slowly increasing the skill or slowly decreasing the behavior. And I would say like typically like 2 to 4 weeks, you should be seeing some type of positive progress, right? I mean, I'm not going to say like you're going from like not speaking to speaking in full sentences in that period of time, but you should be seeing some type of incremental progress towards your end goal within 2 to 4 weeks, or program changes, right? Because that's the other thing in the beginning, right? We're still getting to know the student. They're still getting to know us. So maybe we are making changes because we're not seeing progress. So if you're not seeing change in 2 to 4 weeks, there should be not like necessarily a massive, like now we're not doing this, we're doing this whole new thing, but there should be some sort of incremental change, right? Like, okay, well, it's not working when we're doing it this way. So we're going to change the prompting to this, or we're going to change the reinforcement to that, or we're going to change our teaching approach to this, right? So not massive, we're throwing out the whole behavior plan and starting again, or throwing out the whole skill acquisition plan and starting again, but we're not seeing forward momentum. So we need to make a little change and see if we present the stimuli in this way, or we prompt in this way versus that way, do we get better results, right? And all of that should be happening. Now, hopefully, once the behavior consultants worked with your family for like 6 months, they know your kid really well, they know his learning style really well, or her learning style really well. And so they can just come in and be like, okay, we taught colors in this way. So when I'm going to teach, shapes, I know exactly how to do that because we did this with colors. So hopefully as you go along, like the tweaking is a little bit less as you go through the programming. But in the beginning, you're taking your best guess based on what you know about this student and what you know about other students that you've worked with that have been similar to them, right? So I'm starting with this thing, but it may not be exactly right. And I might have to make some tweaks because that's where the individualization comes in, right? So I might have this certain prompting hierarchy written in, but for this kid, now I need to change it and step 2 becomes step 3, et cetera, et cetera. But I don't know that until I try it, right? And that's why this is all data informed. We have the data to say it's working and we're seeing slow gains towards that end goal, or we have the data to say it's not working and we're flatlined or we're decreasing, so we need to change something.
So typically 2 to 4 weeks with daily practice, like either from parents or BI, you should see something change, like either better or worse, right? Then you have to redo the reprogramming. But if in 4 weeks we don't see any change, that means it doesn't really work.
Exactly. And it doesn't mean that ABA doesn't work. It means that what's happening with your particular student at this particular juncture isn't working. Yeah, exactly. And I think you should, as a parent, be able to go to your behavior consultant or behavior analyst and say, hey, I've noticed this thing and it's not getting any better. What can you tell me about that? And they should be able to say like, oh, well, I see that, I hear what you're saying that the data doesn't show that, but let me show you the difference. Like, let me show you what he's doing now. And I can tell you how it's different from what he was doing 2 weeks ago. Right. So like, maybe, I don't know, he's responding faster or he's making fewer errors and he's not quite at our mastery criteria yet, but he's working his way towards that. Right. Or I can show you a graph that shows you like, not going to be a straight line, but like a jaggedy line that's slowly moving upwards. Right. So they should be able to point to something in their programming that says, we just need to keep going. We need to try this for a little bit longer because I do think it's working. It just hasn't been in place for long enough yet. Or, you know what, you're right. This isn't working. We've been flatlined for 3 or 4 weeks. Because the other problem is if you flatline on something from a learning perspective, often at times that's when, if you let it go on for longer than 4 weeks, that's when kids start to get frustrated. And then that can create, right? That can create like then an aversion to working on that particular skill because they're like, I've been doing this same thing for 4 weeks and I still don't get it. Right. To me in a different way.
I'll be frustrated.
Right. Teach it to me in a different way or I'm going to get mad. Right. Like you said, like we all would feel the same way. If I've been trying to learn like 10 new vocabulary words in Spanish, say, and you're just drilling me, and I haven't got them in 4 weeks, 2 more weeks of practice probably isn't going to help me learn those 4 words in that way. That doesn't mean I can't learn them. It just means I need to be taught them in a different way than what you're teaching me. Right. And so that's what the data tells us. The data doesn't tell us that the kid isn't learning. The data tells us that we're not teaching that in the right way.
Right.
And I need to figure out a different way to teach it. I need to be creative in terms of like how I go about teaching it. Or it tells us they're learning the wrong thing. Because sometimes I've had kids where I'm like, oh, wow, you learned to pay attention to the totally wrong part of what I was teaching you. Like the rip in the corner of the stimuli is what you're paying attention to, not the actual picture on the photo card, for example, right? And I figured that out like 2 weeks in, and I'm like, oh shoot, we got to go back and reteach because he learned to pay attention to the wrong thing in that situation, right? And that's the trick, and every individual is different, but that's a trick often in autism, right? As one of the core things that happens, and we know this from research, is they attend to different parts of the stimuli. I'm not going to say the wrong, but different than what we as neurotypical people are attending to. So we think we're teaching them one thing, but they're actually learning a whole other thing over here because they're paying attention to a different part of the stimuli than we are.
Right.
So that's where the detective work of the behavior consultant, that's where the behavior consultant should come in.
Yeah.
Right. And problem solve. The BI might be able to make observations and share them with the behavior consultant, but they don't have the knowledge or the experience to make those program changes that are going to be helpful in moving the kid past whatever that learning barrier is.
I see. Good point. Never thought of that. And this is very autism specific, I have to say.
Yeah, no, it's very much so. I can't tell you how many times where I've been like, oh, that's what you've learned this whole time. Not what I was trying to teach you in this situation, but you paid attention.
You learned something. but not what I want you to learn.
Exactly. Not what we were trying to teach you. So now I got to go back and rethink how I'm teaching to you.
So
right?
we'll give it like a 2 to 4 weeks try, and then
Yeah.
maybe modify the program if we don't
Exactly.
see the results
Yeah.
we wanted to. So like we mentioned a lot about like behavior consultant and BI. So is it typically that autism funding will fund both? I think you mentioned a little bit about like your
Yeah,
other
they
sector.
they typically do fund both. The question is, how many hours a week can your money buy you? And I will say that in the current economy in BC, it is less than what it used to be because the rate for BIs is kind of astronomical, frankly.
I know.
Particularly in the lower mainland, it's very, very high. So what your $20,000 or $6,000 worth of funding used to purchase you is not what it currently purchases you anymore because the hourly rate has increased, right? So, and I'm going to ballpark this because it's been a while since I've actually done the math. I used to say that $20,000 a year or whatever it is, 22, whatever it is now for the under 6, buys you somewhere in the neighborhood of, 10 to 12 hours a week of intervention, right? And the 6,000 buys you somewhere in the neighborhood of like 2 to 4 if you're spreading your money out over the year. Yeah. So $6,000 really doesn't buy you and that includes your behavior consultation on top of that, right? Because like I'm factoring that into the cost. And that doesn't include if you're doing like speech therapy on top of that, then that's going to come out of that pool, right? And that's why I think you have sometimes professionals who are in competition with one another in essence, because you're both kind of fighting for the same pool of money to a certain extent, right?
Unfortunately,
Again, I don't
yes.
think that should be done to the detriment of the kid at all. But that's where the budget is tight. And so it does get tricky in terms of how much can you buy with that money, essentially, right? So yes, you can pay for both, but how you pay for both and how much you pay for both sort of depends on, what other sources of funding that you have that you can bring into it. Like, do you have some respite funding that can be used to pay for some BI time? Do you have some, for example, for me, because I'm a licensed psychologist in BC, people can use their extended health benefits to pay for some of my time. So can you sort of be creative and pool together? But, do you have at-home funding that maybe will pay for some speech? Like, do you have other sources of funding that can kind of be pooled together to make it possible for you to have more hours of service?
I see.
Stretch your budget a little bit further, in essence, right?
So essentially, a behavior program should be delivered every day, right?
I mean, ideally every day, right? But again, I think that really depends on the needs of the student. So if I have a really low support need kid who needs like a little bit of help with some social skills and understanding perspective taking and that kind of thing, then maybe I don't need every day. Maybe twice a week for an hour and a half is plenty. And I think that's really an individual conversation with the behavior consultant, sort of like once they get to know your family and your kid, right? That was usually part of my intake process is like, I interview the parent and then I talk about like, do you have in mind a certain number of hours per week that you're thinking? And then if they said no, what do you recommend? Then I really take into consideration, like, is this a kid who learns really quickly? You know what I mean? Like if it's a kid who learns quickly, you don't need as many hours. If it's a kid who takes a long time to acquire skills, then you need regular repetition. Otherwise, you're not going to see very much progress, right? So like some of my super smarty guys that like learn stuff super quickly, you can do 2 or 3 sessions a week and get a lot done. My kids who are more cognitively challenged, right? Who take, 500 trials to learn a single thing. You need a lot of time with them in order to see that progress, just because they take more repetitions of each skill to learn it. If a kid can learn something in 3 trials, you can get a lot done in 2 sessions a week.
True. So ideally, autism funding should be individualized.
Yes. Yes.
Okay.
Well, it's very interesting to me, like, working across the border, right? Because which is so funny, in Washington State, it's insurance funded. And we put together an individualized proposal per client. And we ask for a certain number of hours of service. And that, the behavior consultation hours and your BI hours and your SLP hours are all sort of separate pools, and everybody can independently request how much hours they think your kid needs. And so you can have a more robust program down here because I can request, like for a young kid, I can request 20 hours a week if that's what I think they need. Right. Whereas in BC, you get a certain amount of money and everything has to come out of that. And so it's a very different system. And it leads to, you know, I mean, there's problems with the individualization and how do you do that in a structured, equitable sort of way? But it does really, I agree, lead to the conclusion of some kids, for some kids, $22,000 or $6,000 is fine. And then for other kids, it's a drop in the bucket. And those are generally the higher needs kids in terms of support needs, right? Like who have the more challenging behaviors, who have less verbal skill, you know, all those types of things that just make it so that more intervention really is necessary in order to make meaningful progress and reduce some of those really dangerous behaviors in the long run, right? Dangerous to themselves or dangerous to other people.
Yeah, it's a very different system, honestly.
Yeah.
But yeah, I think that's my last question. And thank you, Sara, for spending the time with us, explaining what a behavior consultant is. And we have an idea what a program looks like and how long shall we analyze it, whether it's effective. Very important resources for our members and for families and for the team. And also a very good point that we can come up with a questionnaire, like interview questionnaire for when you're working with a consultant, when you're interviewing them, what to ask. It's a very good point.
Yeah.
Thank you for suggesting
Thank you for having me.